Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer. Generally speaking, when we're talking about stages, and I say generally because it's different for every tumor type, and it actually changes over time, there are some subtle differences from year to year for many tumors. So I wouldn't take what I'm saying right now as a hard and fast rule. It's more, here are the principles to talk to your doctor about and have a sense of it. Generally speaking, stage 1 is small tumors that have not had the ability to spread. So these are the things that tend to be surgically resectable or treated with radiation. And you may or may not have a systemic therapy like a chemo or pills to attack the cancer after. But the primary goal here is to cure it, to cut it out, or remove it in some way. Once we get to stage 2, as we march up in stages, what that really means is higher risk for the most part.
Mm-hmm.
Stage 2 is usually larger tumors. Maybe it's spread a little bit to lymph nodes. Now, that process can still be considered it has metastasized to a lymph node. The purpose of a lymph node is to clean out areas. So they're often the first thing that might harbor a stray tumor cell. So a lot of times, this is true in lung, we may see lymph nodes in the area that do have some tumor cells, but that doesn't necessarily mean that the tumor cell has gotten the ability to go in the blood. Because the lymph nodes clean out the local area.
Okay.
But it's not necessarily filtering the blood out that's going to the rest of the body.
Interesting.
So you could have localized metastasis to a nearby lymph node and actually still do very well. And then as we go to stage 3, that's up one more stage from 2, that ends up meaning larger tumors, greater areas of spread. Oftentimes these are harder to cure.
Mm-hmm.
And once we get to stage 4 is really what we mean. It has gained that ability to usually go through the bloodstream and establish itself somewhere else. The example here would be the lung to the liver, the lung to the brain. And the way you confirm that is you have to be sure that the other thing you're seeing is the cancer.
Right.
And it's not always super clear. Sometimes the scans are very clear, but often it's not. Samantha, was that a good description of the staging
absolutely
system?
Spot on. I honestly didn't know about the lymph nodes and it not having gone into the bloodstream yet, because I thought it did mean that. So that's really interesting to know. My question for you is, so some people will get treatment at stage 2 or 3, regardless of what cancer they have. And then unfortunately, a few years later, it comes back as stage 4. Not every time, right? But it does in some people. And so I'm curious the science behind that and why that might happen.
Yeah, that's a great question. And it's true in stage 1 too. For many cancers that are stage 1, what that means is we've identified a small area, we've been able to remove it, and to our knowledge, there's no cancer anywhere else. And I think in order to really sink our teeth into this question, we need to have a sense of how we determine if something is spread or not. The big scan that we talk about in oncology is the PET scan mostly, PET. And not every tumor uses PET scans. Sometimes regular CAT scans are fine. But many people get PET scans and they're not sure what that is. So I want to take a second to clarify that. A regular CAT scan that you would get for cancer or for other things will often use a dye that will go to areas that take up a lot of blood. Tumors will do that. It's very active. It'll take up blood. And it'll take up the contrast and it lets the radiologist see if something's there or not. But the way it functions is it looks at different densities as it scans up your body. For example, your bones have a lot higher density than the air in your lungs. So the air in your lungs is black because it doesn't take up any of the radiation, and the bones are white. So you have that really, really strong contrast. And if a tumor is there, it'll see that object. But if it's really, really small, like maybe less than 3 millimeters, 2 millimeters, 1 millimeter, really small, it's hard to tell. It's hard to be confident that there's anything abnormal there, and it's certainly hard to be confident that it's a tumor. So that's how CAT scans work. People are frequently confused about how a PET scan works. And the way a PET scan works is rather than using the difference in radiation density, your bone density or the density of tissue alone, we add this other thing called a dye, or called FDG. So this is a substance that we inject into the blood that's essentially sugar. It's sugar that's tagged with something we can see with the scan. So what this does is anything that's eating a lot of sugar will be bright. So if you have a cyst, that's not going to show much because cysts just hang out there. But if you have a tumor that's very metabolically active, it's eating up a lot of sugar, that will turn bright on the PET scan often. And other things like your brain are often eating a lot of sugar, that'll turn bright too. And you'll see that sometimes when the bowel's contracting, you can see that. So you have a few things that we know are going to be bright, and anything other than that, we have a good sense that something's there. The PET scan's not perfect. It can, inflammation, often it can't tell. And then, there are some things that are hard to differentiate, but same problem does occur where if something's really, really small and you can't get a lot of signal, then people will not be able to tell that there was a cancer there. So for tumors that have spread and there's just a little tiny bit of tumor there, we often can't see them. The analogy I'll often use is seed and soil. So you can think of the tumor as a big weed, and the weed has spread out seeds into the surrounding soil. You can pull that first big weed, you can cut out that first tumor. But once that weed had germinated, once seeds spread, they're very small. It's really hard to tell. So a lot of times we'll use chemotherapies and other types of therapies that go everywhere because that's kind of your weed killer.
Mm-hmm. I like that analogy.
Yeah. But it's hard to know, if you're a gardener, you're not going to know where those seeds landed until they've started to grow.
Mm-hmm.
So that's why, even though you have one primary lung tumor, once it's gained that ability and it's shedding out tumor cells, which are kind of like the seeds here, you'll get multiple deposits in different areas, and those will each grow, just like a seeds would for weeds.
So it's kind of, so I hear sometimes people saying, like, when they're stage 1, 2, or 3, that they've had surgery and the surgeon will say, like, oh, I got clear margins or I didn't get clear margins. Does that kind of relate to the analysis you kind of were talking about a little bit, in the sense of, like, if you didn't get clear margins, it means that some cancer was left or some seeds were left, so to speak, in the body?
Yeah, I think that's a good way to say it. If you, in this analogy, it would be like leaving some roots behind.
Gotcha.
And you know that those roots can still grow.
Yeah.
And we would have to do something else most of the time.
Yeah.
Depends on the specific type of cancer, but usually we want to have clear margins.
Gotcha.
So the next thing we were hoping to talk about here was how this process of metastasis might change treatment. And everyone that's talked to me in my clinic, they associate metastatic disease or metastasis with stage 4, with incurable. And in a lot of cases, that's true. It's not true in every case. There are certain diseases that when they've spread, they are very sensitive to certain therapies we have, and they still can potentially remain curable. And I'll go so far as to say, even with some of the more traditionally incurable stage 4 things, we're still starting to treat them now, or we're beginning to treat them now, as though they are curable if it hasn't spread very much. So I think there's been a pendulum swinging because some of our therapies have gotten much better over the last 5, 10, 15 years, that if a tumor had maybe just gone to the liver and you just have 2 areas of disease, well, it's possible that we could do a surgery in the lung, do a surgery in the liver, and then, maybe there weren't that many seeds out there, and that's why it only grew in one spot. Or maybe those seeds are so inefficient and ineffective at, setting up shop and growing, that we can do that resection, and then, you monitor it. If something else comes up, we'll take it from there. So I want to just make sure that people hear that if you're diagnosed with a stage 4 cancer, not all stage 4 cancers are the same. So there's very, very nuanced treatments for everyone. Not all stage 3 cancers are the same. Not all stage 2 cancers are the same, but it's true with stage 4 too. And I want to definitely get that out there, because I've heard so many people come to me, and people that, family members, loved ones who have been diagnosed with stage 4 cancer, and they have this idea in their mind that their life is over now.
Mm-hmm.
And I don't think that's true. I think cancer is really unfair. And unfortunately, a lot of it is just bad luck. So for some people, their lifespan is going to be short. But I wouldn't assume that, particularly now with a lot of the treatments we've developed recently.
Yeah, I would say that when I finally comprehended, because again, I don't think anyone ever told me like, you're stage 4 and you have metastatic disease. I think I just kind of figured it out myself, and obviously people talked to me about the severity of it, but like I always associated stage 4 with like, you are on hospice, right, wrong, or indifferent.
Mm-hmm.
And I very much had this perception of like, okay, you're stage 4, you're likely going to die in the next 3 months, you're in hospice, you need lots of care. And while unfortunately that might be the case for some people because they're diagnosed so late in their stage 4 process, right? It's not the case for everyone at all. And for myself personally, yes, I'm stage 4, but I'm hiking every day, I'm lifting weights, I work full time, I live a very active lifestyle still. And looking back when I was in my 20s, if I knew that was what stage 4 looked like, even if it is just for a few years, I'd be like, okay, well, that's not as bad as I thought it was. People can thrive for X amount of years in stage 4 because treatment has come so far. For some people, and again, not everyone, right? It depends on your cancer, it depends on how much disease burden you have in your body, but it's definitely a mindset shift for me personally, being like, oh yeah, I have to remind myself I do have stage 4 cancer. Oh crap. Because I do feel so great, and that's so weird because I never associated that with stage 4.
Well, you raised a really good point, which is, what is it about cancer that causes symptoms?
Right.
I think a lot of people assume because they have stage 4 cancer, they're going to have a lot of symptoms.
Yes.
And they also have this assumption that the treatment for the cancer is going to cause more symptoms than the cancer was causing.
Yep.
Mostly this is around chemo.
Yep.
And I'd like to dispel that theory a bit. For some people, they do have big reactions with chemo. But generally speaking, people tolerate the chemotherapy regimens these days fairly well. And their quality of life is better on it if they had symptoms from cancer at all,
Mm-hmm.
assuming the chemotherapy is working. because we wouldn't do it otherwise. The goal of therapy for people who are on chemotherapy with metastatic disease, the disease that has spread, is to give someone the longest amount of life of high quality.
Yep.
That's what matters. And for people who have a large volume of metastatic disease, so imagine, not the 2 centimeters in the lung and 1 or 2 areas of the bone. Some people have a really, really large volume of metastatic disease. It's throughout their bones. It's in their liver. Maybe it's gone to the other lung.
Mm-hmm.
They might have fluid around their lungs. People can be really, really, really symptomatic. That amount of cancer is doing a lot of things metabolically.
Mm.
It's siphoning the energy from the bloodstream. It's making someone very, very fatigued, very short of breath. And then it's really hard to do the things that you want to do.
Yep.
In those circumstances, the chemotherapy regimens that we tend to give, if someone's well enough to receive them, are going to probably make them feel better. The caveat with that is that chemotherapy is not benign. And for patients, for people who have cancer and they're very sick, chemotherapy can shorten their lifespan.
Yep.
So
Absolutely.
This is a challenge we have to navigate. And through the ethos of do no harm, there have been patients where we can't ethically give chemotherapy because they're just too sick.
Yeah.
And that's a really hard bridge to cross. And because the consequences are very grave. But the decision is made because we want them to have the most time of the highest quality of life.
Yep.
And it's hard to convince someone of that's what it is when you're hoping that this is going to be a really profound treatment.
Absolutely.
So all these things are very nuanced conversations with your doctors.
I'll hit on the first point you said, because before I was diagnosed, I was fatigued all the time and I had no idea why. I was like taking naps all the time. I lost like 5 pounds, which is a really big deal for me. And so those were kind of my key indicators before the real stuff started happening with the fluid in my lungs. But I want to say probably the 3rd cycle of my chemotherapy, I said to my doctor, I feel the best I felt in like 5 years. And I said, this is the weirdest thing to say because I have stage 4 cancer and I have cancer in my liver and other parts of my body, but I feel amazing. And even my mother and my husband were like, you look so good. Like you're just, I don't know, you look less tired, you look healthy. And it's like, how ironic that I'm stage 4, I'm on chemotherapy, and I feel and look the best I have in 5 years. And it's like, oh, wow, like I really was sick and I had no idea. And now I'm getting treated. This is what it's like to feel like a normal person, at least for a little bit. And it was quite jarring for me personally, to realize this is actually how you're supposed to feel as a human being.
Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please like, subscribe, leave us a review, and visit crackingcancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research. Because together, we can crack cancer.